Welcome to Introduction to First Aid, Part 3. We're going to talk about the contents of a first aid kit. Now, a first aid kit is used to treat non-emergency situations and provide instant care in emergency situations. There will be safety pins. The recommended number is 5, and it is used with triangular slings. This is the triangular sling I'm talking about. We will also need at least one triangular bandage for making a sling when someone has a fracture or to act as a pressure pad to stop bleeding. There will be a pair of scissors for cutting bandages, dressings, or gauze pads to fit the size of the wound. There should be plasters, at least 4 in the first aid kit, but of course this is just a recommended number. But for tiny plasters like this, we should have as many as possible to use them for covering superficial wounds. That means wounds that are not deep and they usually stop bleeding quite quickly. We should also have 2 crepe bandages, one small and one big, depending on the injury, for securing the dressings or providing compression to stop the bleeding, and use it to provide compression when someone's ankle is swollen, when there is a sprain. And this is a must-have, one disposable latex gloves. This is to protect the first aider from infection or contamination. We do not touch blood or any kind of discharge without wearing gloves. Next, you will need tweezers. It is used for removing splinters in a wound or used for you to pick up the sterile gauze. Next, we should have alcohol swabs. The recommended number is 4, but I would suggest putting more than 4, at least 10, because this is very useful for cleaning the wound, for cleaning the skin around the wound. Take note, we do not apply these alcohol swabs directly on the wound because it will hurt a lot. So it's for us to clean the blood stains or any kind of dirt that's found around the wound. You should have at least 2 sterile gauze in your first aid kit. This is used for cleaning the wound directly, or it can be used as a dressing to help to stop bleeding, or like what I said, simply to cover the wounds. Now, this is a resuscitation mask that we use for CPR when you need to have mouth-to-mouth contact, but you avoid that by using a resuscitation mask. During this COVID-19 period, this is absolutely not recommended at all. If you do CPR, just perform the chest compression. We do not have to do this mouth-to-mouth resuscitation. Now, what happens is you do not need a mask like this in your house because if no one in your house can perform CPR, this mask is totally useless. So this mask is usually only found in large buildings like shopping malls or stadiums. Okay, thermometer and thermometer covers. Now, if you are using the mouth thermometer, like the one you see in the picture on the right, those are used for measuring temperature under the armpits or under the tongue. So you need the thermometer cover. But if you are using the thermometer on the left, which is the infrared thermometer, then of course this is the preferred one because it is really more hygienic and prevents the transmission of any diseases. Okay, cotton wool, gauze pad, and distilled solution. These are all used for cleaning wounds. Remember, we talked about the tweezer. You will use the tweezer to pick up the cotton ball or the gauze, and then you will you will pour the distilled solution onto a tray, usually we call it a kidney dish, and then you can dip your cotton ball in and then clean the wounds. Sterile eye dressing for covering eye injuries. As you can see, this is exactly how it looks like. But do take note that when you tear it off, it may remove some of the person's eyebrow. So you may want to let your casualty know that this could happen. But of course, the injury is so severe, you need a sterile eye dressing to prevent infection. Adhesive tape for taping the ends of dressings or bandages. If you don't if you don't have the kind of plaster, the handy plasters that we have that comes with this tape for sticking, then you have to have this adhesive tape, which works like a scotch tape. You cut the length of the tape you want, and then you tape the sterile gauze together. Finally, an ice pack. This is a disposable ice pack. It is to relieve pain, swelling, or inflammation, especially when someone is running and they may have sprained their ankles. This is very useful. You press in the middle, you will hear a tiny pop sound, and then after that, it will become cold for about 20 to 30 minutes, and after that, you throw it away. Okay, although it states here that you should have a pen and notebook in your first aid kits, but it isn't compulsory. So you won't find them in those large shopping malls or stadiums. But at home, it is recommended because should someone in your house um, should someone in your house have an epileptic fit, you will want to take note how the duration of the fit, what time it starts, what time it ends, and if you are recording the blood pressure of your relative who has fainted, you may want to, yeah. So this is good for recording purposes. This is the end of introduction to first aid.